station 14, long model. So, this is the
Lungs.
right lung.
Sabog RJ.
Right lung. Right lung. So you have the superior lobe, you have the middle lobe, and then the inferior lobe. So you have two fissures. You have the oblique fissure and then the horizontal fissure. And then medially, you have the hilum and then the pulmonary ligament. So for your hilum, you have the right main bronchus, which divides into two. The upper segment would be your right, I forgot, right lobar epiarterial bronchus, and then the other would be your intermediate bronchus. So your intermediate bronchus will further divide into two. One will go to the middle lobe and the other will go to the inferior lobe. And bakit siya epiarterial? Kasi mas mataas siya sa pulmonary arteries dito sa right lung. So this here would be your pulmonary arteries. Here would be your pulmonary veins. And then for the impressions, you have the cardiac impression here. We have the IVC, the SVC, and then the esophageal groove. Good. So for the right lung, you have 10 bronchopulmonary segments. So that's 3 for the upper lobe, or for the superior lobe, 2 for the middle lobe, and then 5 for the inferior lobe. So for the superior lobe, you have apical, anterior, posterior. For the middle lobe, you have lateral, and then the medial. For the inferior lobe, you have 5. So superior, and then yung 4 na basal. So for the basal, madali lang siya. That's anterior basal, medial basal, lateral basal, and then the posterior basal. So yun, 3, 2, and 5. So that's for the right lung.
So for the left lung naman, we have how many lobes? Two lobes. The superior and the inferior lobe divided by the oblique fissure. So we don't have horizontal fissure. However, sa exam, they tend to cut the left So you have to look at the cardiac notch and the lingula. Cardiac notch and the lingula. So dorsally, yung mga important parts, cardiac notch, lingula, the inferior border, and the So, ventrally naman, you have the diaphragmatic surface. This one is the cardiac impression, and this one would be the thymus impression. So, if the heart is here, most probably, this one is the descending arch of the aorta. And then, sa apex naman, you have 3 common grooves. From medial to lateral, you can remember BV sa trachea. BV sa trachea. So, brachiocephalic vein, the subclavian artery, and the most lateral part will be the trachea or the esophagus. So, we now proceed to the bronchopulmonary segments. Yung clue nyo again would be their name. So, anterior, posterior, medial, and lateral. So we have 4 segments for the superior lobe and 4 segments for the inferior lobe. So first would be the apex, right? So apico-posterior segment, and then the anterior part. This is it, anterior segment, and then the lower part would be the lingular segment, which can be further divided into superior, lingular, and the inferior. So again, you have the apico-posterior segment, the anterior segment, the superior lingular, and the inferior lingular. And now proceed to the inferior lobe, which can also be divided into 4. So anterior medial part, and then the lateral basal, the posterior basal, and then the upper part of the inferior lobe, which is the superior. So again, what are the segments of the inferior lobe?
Intermedial, lateral,
Posterior basal, and the superior. handling nila, superior, inferior, superior, low. Okay? So, it's not this, it's not this, this.